Here's Channel 8's Eyewitness News at 6:30.
Baldness is something that affects millions of men in this country, but there are things you can do if you don't want to accept losing your hair.
The search for a cure for baldness has been one of the longest pursuits in medicine. But today, there really are alternatives to losing one's hair. Joining me is Dr. Paul Andrews, a board-certified dermatologist, to talk about a new technique which promises better results. What is it?
Well, basically, Dr. Corbett and I, when we transplant, we're actually transplanting hairs with the aid of the microscope. And we basically get it in the individual natural groups.
Yeah.
Let me explain what the natural grouping means.
Okay.
If you take a microscope and examine the scalp, hairs don't just come out individually in groups of ones. They actually come out naturally in groups of 1 to 4. And so that's how God has made it, and so that's how we transplant it. And we'll put the 1 hair grafts up front and the 3 and 4 hair grafts farther back on your scalp.
Is this a scalp we're seeing here?
Okay, actually what this is a piece of the donor tissue that we're dissecting out. And this is with the aid of the microscope. And this is what makes the microscope so effective. It's enabled us to be able to see each and every natural group of hair, where with the naked eye, we wouldn't be able to see that, or using low magnification, we wouldn't be able to see that. So it would have a lot more trauma to the surrounding hairs and cause a decrease in survival rates.
So the tool is part of the effectiveness of the technique?
Oh yes, the microscope has really increased the survivability of the grafts and the percentages.
Now I know we have some before and after pictures that are really good, some cases that we had seen. Let me ask you, first of all, why is this better than other techniques?
Okay, well, the two main reasons. One is it's greatly increasing the percentage of survivability of the grafts.
Okay.
2 is
in other words, the hair stays in.
The hair stays in, exactly. And 2, the natural results are unsurpassed. Where the results are amazing, and you probably can see on the screen.
Yes. Is this more expensive than other techniques?
Well, it's comparative to the other techniques. And if you look at that transplant, that patient had bigger grafts before, and that was actually a corrective surgery where we sprinkled in a lot of the natural hair groupings all around the bigger graft so you could conceal that pluggy look.
Okay. Now this has always been an interesting field, and it seems to be growing and growing and growing. The latest buzzword you said is Propecia. Tell us what are the pros and cons of that?
Propecia, I think, is an excellent drug as far as its effectiveness. There's no drug on the market that has better results than Propecia, but it has limitations too. And where we're seeing the best results is in a young man that's just starting to bald in the vertex, which is the back of the scalp. When we talk about the front of the scalp, we're not seeing as good of results. Why this happens, we truly don't know. And that's just where hair transplants are most effective, when you plant in the front. Now, as far as side effects, there's been a lot of sensationalism of the side effects of Propecia. And actually, Dr. Corbett and I, our whole practice is hair loss and hair transplantations. We probably have over 200 patients on it. Not one has had a side effect, except to their wallet. It runs about $50 a month.
All right. Dr. McAndrews, thank you so much for coming in and talking
You're very
about
welcome.
the latest techniques in keeping one's hair. Thank you so much.
You're welcome.